The deadline for Americans to sign up for health insurance under the Affordable Care Act with coverage beginning January 1st is midnight tonight. Just hours. Because of decisions made this year by President Trump and Republicans in Congress, subsidies that support the Affordable Care Act are being cut off. As a result, 22 million Americans who rely on the ACT for their health insurance are about to see dramatic increases in what they pay every month. And these are not modest increases. On average, premiums are expected to double. This sudden spike in costs is not the result of inflation, nor is it the result of some unforeseen breakdown in the healthcare system. This crisis is entirely man-made. It is the direct outcome of legislation passed this year. A switch was flipped, a policy choice was made, and now millions of Americans are facing the consequences. The impact is already rippling through the political system. Republicans in swing districts are under intense pressure from constituents who are suddenly staring at unaffordable health care bills. Across the country, headlines reflect growing alarm and political fallout as lawmakers brace for backlash over expiring subsidies and soaring premiums. Despite the pressure and despite widespread acknowledgement that this is a real problem, not a messaging problem, Congress has failed to act. Leadership from the White House has been largely absent. When asked about the looming increase in health insurance costs, the president dismissed the concern, telling reporters not to make it sound so bad. At the same time, the administration has been systematically dismantling the nation's public health infrastructure, once considered the gold standard in the world. Experts at the Centers for Disease Control and Prevention have been fired or forced out. Long-standing scientific processes have been sidelined. Political appointees with little or no public health background have been elevated into positions of influence. Vaccine guidance has been altered based on ideology rather than evidence. The consequences extend beyond policy debates. The administration has announced plans to eliminate more than 30,000 healthcare jobs at the Department of Veterans Affairs, further weakening care for veterans across the country. As federal leadership retreats from science and evidence-based public health, a new dynamic is emerging in the United States. Democratic-led states are stepping in to fill the vacuum left behind. In California, Governor Gavin Newsom has moved to rebuild public health capacity at the state level by hiring former senior CDC officials who resigned in protest over the federal government's direction. These leaders are now tasked with strengthening data sharing, improving pandemic preparedness, expanding laboratory capacity, and coordinating responses to global health threats. Their work is not limited to California alone. Regional partnerships are forming as states collaborate to create a science-based public health network that operates independently of weakened federal institutions. This shift has the potential to fundamentally reshape how public health functions in America. Increasingly, access to reliable health guidance and effective disease prevention may depend on which state you live in. As federal agencies grow more politicized, Americans are being forced to ask a basic question. Who can they trust for accurate health information? The stakes could not be higher. Vaccine-preventable diseases are re-emerging. Children have already died from illnesses that modern medicine knows how to prevent. Public trust in national health institutions has been severely damaged. Public health leadership in the United States, once centralized and driven by science, is now being rebuilt state by state. And for millions of Americans, the future of their health care, their financial security, and their safety may soon depend not on national policy, but on geography.